These habits gradually damage your kidney without you knowing. Some people do it daily. Stay with me as I reveal those habits to you. I'm Ifeanyi and welcome to my channel. Let's jump right into it. Number one is dehydration. You see, many people underestimate the importance of drinking enough water daily, and with sufficient daily water intake, the kidney functions efficiently by filtering waste and toxins, maintaining the body's fluid balance, and regulating important chemicals in the body. And when the body becomes dehydrated, the kidney is forced to work harder to carry out those functions. And this can gradually damage the kidney, increasing the risks of waste buildup, kidney stone, acute kidney injury, and even urinary tract infection. Number two, excessive consumption of salt. You see, excessive salt consumption places an extra strain on the kidney, disrupting the body's fluid balance, increasing blood pressure, and also gradually damaging the kidney's delicate filtrating units. Now, this can actually increase the risk of proteinuria, which is the abnormal high amount of protein in the urine, glomerular hypertension, kidney stone formation, tissue damage, and it can also impair the osmotic balance of the body. Now, the third one is excessive use or consumption of analgesics, painkillers. Now, especially the non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, diclofenac, they actually block the cyclooxygenase enzyme from producing prostaglandins, which is a very important chemical that ensures that there's an adequate blood supply in the body or to the organs by relaxing the blood vessels. Now, this can actually lead to limited blood supply, and it can damage or gradually damage the kidney, increasing the risk of long-term scarring, analgesic nephropathy, electrolyte imbalance, acute kidney injury, and it can also inflame the kidney's filtrating structures, leading to either glomerulonephritis or interstitial nephritis. Now, the fourth one, smoking and excessive consumption of alcohol. You see, both smoking and excessive consumption of alcohol reduces the kidney's ability to filter the blood and to regulate the fluid balance. Smoking primarily leads to, or it injures the blood vessels and it reduces blood flow. Now, cigarette contains nicotine, and nicotine is known to cause vasoconstriction. Vasoconstriction is a narrowing of the blood vessels, and when the blood vessels are narrowed, there will be limited blood supply to the tissues of the kidneys. Now, the carbon monoxide in the smoke is a toxic compound in the smoke that pops out from cigarettes. It contains this toxic compound called the carbon monoxide. The carbon monoxide damages the endothelial lining of the tiny blood vessels inside the kidney, leading to an endothelium dysfunction. It can also lead to renal arteriosclerosis or nephrosclerosis, which is the narrowing of the arteries of the kidney as a result of plaque buildup, the stiffening, the hardening of these arteries, right? And then alcohol places a toxic stress on the liver-kidney axis, disrupting the fluid and electrolyte balance, suppressing the important hormonal regulation, and also contributing to cellular mitochondrial stress. This actually leads to liver disease, which can in turn affect the kidney, leading to hepatorenal syndrome. The next one is lack of physical activities or exercise. They say lack of physical activities or exercise doesn't damage the kidney directly by causing systematic vascular damage, mitochondrial or metabolic stress or overload. What it does is that it starves the blood vessels of nitric oxide, which is essential for maintaining the flexibility of those blood vessels. And when this nitric oxide or these blood vessels are restricted or starved from this nitric oxide, it leads to stiffening of these blood vessels. which actually results to a force of high pressure blood into the kidney, crashing the kidney's delicate filtrating unit, which is the glomeruli, leading to a permanent scarring. And the next one is holding urine for too long. You see, it's normal sometimes traveling and other reasons, but it's very important that when this urge comes, you excrete those urine, because it actually turns the urinary bladder into a breeding ground for bacteria. It can actually lead to urinary tract infection, which affects the urethra, the urinary bladder, the ureter, and also the kidney. And it can also lead to a backward fluid pressure, which is a vesicuretral reflux. Now the next one is consuming poor diets. Food with too much sugar, too much salt, ultra processed food. Now what this does is that it creates a toxic compound called the AGAs. That's the advanced glycation end product, and it's also spiked uric acid. And this actually physically thickens the kidney filters and reduce the kidney's ability to filter or to regulate fluid. And this results to a massive internal tissue stress and failure. If you find this video helpful and educative, please like, share, subscribe, and I'll see you in the next video.